My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, Felicia had a question about old school medicine versus new school medicine, or millennial medicine. So old school medicine I will describe in a second. Millennial medicine I will also describe. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. This should be a tutorial, but I thought because Felicia was coming in with multiple medical problems or multiple issues, I thought I would make a good chase for this. Now, old school medicine. When I was going to medical school in the 80s, late 80s, we had to learn the basics. In the Philippines, the schools in the Philippines are kind of like the schools on the East Coast. Old school, hard knocks, got your knuckles wrapped, you got embarrassed by the doctors if you didn't know your crap, got to stand up in front of everybody. So you really had to know your basic science. And before, we used to have diseases that would present as end organ diseases. In other words, like congestive heart failure to its max, or cirrhosis of the liver, failure of the liver, or renal failure, kidney failure, insufficiency of the kidneys. So when you had somebody presented in a hospital, or in the Philippines, infectious disease, different types, but when you had somebody present in a hospital, usually they presented almost end stage. Either they didn't see doctors for a long time, or they kind of just accelerated their disease process because they got in too late. So the question was when that patient presented, you would have to know the timeline of this is how the heart ends, the disease of the heart dies, or the patient dies, and this is how it begins. And you have to know the timeline because different patients would present different points of the timeline, and it might be kind of presenting about the same as a kidney failure, as a cirrhosis failure, a liver failure patient. So you'd have to kind of sift through the patient, kind of figure out where you're going, commit to one of the diseases, see where they fit on each timeline, and dive into that timeline. Once you figure out which of the diseases or which of the organs that patient was having that was failing, then you supported that organ, reverse the disease, save the day. So, or you lost the patient, but you would be able to tell the family, okay, everybody else has to watch out for your livers or your kidneys. Now, that's how it used to be, and there was a lot of saves and a lot of deaths. But now, I just say, when I was in residency and seeing patients in the last 20 years, medicine's changed. Pharmaceuticals became very good at advertising. Pharmaceuticals became very good at pouring out, getting FDA approval fast tracking, and so we were a generation of doctors that would supplant and give prescription medicines. So if you did that same timeline of end organ failure to the beginning presentation, that timeline, we would get patients in the United States about here in the beginning. And what we would do would be give medicines for reflux, medicines for diabetes, medicines for heart failure, medicines for stroke or hypertension. But we wouldn't necessarily reverse the disease process because we were so busy. I remember when HMO just started out, I'd have to take like stacks of paper. I would have to see patients, but I'd have to take stacks of paper to get like 3 referral papers or carbon copies. It was crazy. And that took up half of the time of the office visit. Now it's computer system, and it takes up more than half the time of the office visit. That'll be at another discussion. But so we would just give Band-Aid medicines and not really get to the root cause of the disease, but we would definitely make patients feel better, and they walk out, do fine for a couple months, but then present back either with a side effect or more need for more medicines. And then again, another medicine for either increased medicine or another medicine for another disease process that's slipping through. But it would be very subtle, all at the early stages. So what that would do would be in the time of millennial medicine, the beginning of the millennial problem, if you ask me, it wasn't really preventive medicine, it was postponement medicine. We would put a Band-Aid on because there was great blood pressure medicines, calcium channel blockers, ACE inhibitors, ARBs, other medicines that would be on top of or super selective. And we would put more and more Band-Aids on, but not take care of this whole problem, because patient either wasn't willing to stop work, or the doctor wasn't smart enough and didn't have the know-how to make those changes or suggest the changes in life. Get off the tobacco, start exercising, cut back on your hours, walk, change your diet. So what we did was we fostered continued visits, saying, okay, here's your next, I'll see your next physical, just take this extra pill. See your next physical, oops, cholesterol's higher, add this pill. See at the next visit. So you have this, over the course of time, a patient would come in, not as bad as what we would see in end stage disease, like in old school medicine, but just nuisance issues. And with all those nuisance issues, you'd have more and more symptoms. So then came the diagnosis of like syndrome X. That's high glucose, a high blood pressure, a low HDL, a weird waist to hip ratio, belly fat. And it would accompany fibromyalgia, sleep disorder, depression, multiple trigger points. So you'd have these diseases that were popping up that they weren't really end stage diseases, but they'd have multiple things with them. And so you wouldn't have somebody that was really dying, but you'd have somebody with multiple things that needed multiple Band-Aids. And you just fostered on, again, without having the right advice to say lifestyle change. And honestly, America, or even in the Philippines, I don't know about Europe, there's not enough time in medical school to teach doctors or soon-to-be doctors about nutrition, mindful practice, exercise. And that's all I do now. This is all postgraduate work for me, and it's by default I had to learn it for myself, because unfortunately I was a patient too, and I'm still a patient, but I'm in remission. I think everybody knows I have fibromyalgia and irritable bowel syndrome and atrial fibrillation, but knock on wood, under control, at least for the next 3 years. I'm sure something's going to happen by the time I turn 60. So the idea, though, is preventive medicine wasn't really taught. We had schools of, or MPHs, that was extra training after medical school and residency to learn about preventive medicine, but there's very few doctors that did that. And number two, it wasn't really rewarding. There's no extra pay for that. Even in integrative medicine, where I took 2 extra years and I learned acupuncture for an extra year, and I did sports medicine for an extra year, I'm not getting paid. In fact, I'm getting paid lower than an average family practice doc. So family practice is at the lowest of all docs. I think neurosurgery or dermatology, and I've got all this training, but I don't get rewarded for that, and I don't have a problem with that, kind of. But I'm going to have to work till I'm probably 75 just to make sure I have medical insurance. But anyway, so the multiple medical problems, the millennial medicine medical problems is just kind of fostering on. We're just pulling that leash along, and now all the people that we used to give this 1 or 2 medical prescriptions to every couple of months to years, they are now presenting with multiple diseases, all almost failing. I can't tell you how many fibromyalgia sufferers that I have. And I told you that's a constellation of 3 different things. But now the fibromyalgia sufferers are coming in with irritable bowel syndrome, active depression and or anxiety on top of the other disease. Or you're having people come in with leaky gut syndrome, brain fog, joint pain, having people come in with the infections, Lyme, and then co-infection, and then problems with depression on top of that. So you're having massive disease all at the same time. Even that syndrome X I was talking about. So now you really have to be well trained to assess number 1 problem, focus patient on number 1 problem, and then package it up, but still learn to reverse the other diseases so they go backwards instead of going this way on the timeline. And impossible to do in 15 minutes. Primary care, that's all we have is 15 minutes. I just don't know. I don't even know how I do it for 15 minutes. Well, I know how I do it. My first patient of the day, I know I'm going to be late. And the last patient of the day, I'm so sorry, but I will really be late because every ensuing visit gets postponed further and further back. That's just the way it works with medical insurance. If you work for an institution, you have to have a set amount of hours or minutes per patient. That's just the way the payment works. Otherwise, the hospital investing in me, they'd go bankrupt, or they would see that we're going to go bankrupt if I spent an hour at a time. I'd only see like 6 to 8 patients. That's at $49.95, especially with what Medicare pays or Medicaid pays. Who's going to make money? That doesn't even pay for my malpractice. So that is, again, another problem. But because of the fury of less reimbursement and multiple medical problems, it's a big challenge. So if you're a patient that's coming in like Felicia nowadays, you really have to take the bull by the horns, learn on your own. There's a lot of good information out there. You just have to sift through what's good and what's bad. What I did back in the 90s, I've always entertained my patients coming in with data. At first, I used to think of it as, oh man, I got to prove myself to this guy because he brought in this stack of papers. I got to read through them. Who has time for that? And I got to say yes, no, I agree, or I didn't know that. Let's just test for it. Nowadays, I'm very data driven. I like the millennials. I like the way the millennials put the data out. I like the PhDs. I think it's very important. Those things called mechanistic studies are awesome versus the old school way where we were taught of observational studies. There's a little bit of a difference there. Observational studies are really heavy bias, but like the Framingham study, the Nurses' Health Study, they are great because of the plethora of lives that they encountered, or at least they covered. But again, the bias is there. You can't ignore, it's good information, you can't ignore it, you have to tease that out. And then the mechanistic studies are really good too. Whether you can apply animal data to humans, we'll see, but if you take the best of both worlds, which is what I suggested Felicia, take the best of both worlds and you can kind of have a foot in all places, then I think you can treat a patient better. So if you do seek out care, you have to respect the doc for the time frame of what they can give you as far as attention span. Now, if you have a big disease, that gets taken care of. All the smaller diseases, in due time. But once you get a big symptom taken care of, Felicia, I would always say, fine, schedule the follow-up appointment and follow that disease process. Hopefully it gets controlled. But on your own, try to use old school medicine to fix yourself. Old school medicine doesn't necessarily mean prescriptions, but it means healthy eating, mostly a whole food plant-based diet. Sleeping. I had a patient that came in, she went to Everest Base Camp. Great gal. Very knowledgeable. Didn't really see doctors, but she only sleeps 4 hours a night, which it's cutting a little short. I think there might be some underlying anxiety, I'm sure, maybe a sleep disorder, but if I'm going to heal that patient up, the first thing I would do is try to snudge out a little more hours of sleep, maybe look at a reason, try to balance life. So you can do that without getting fancy medicines and fancy blood tests. It just means you have to get a coach. So the obvious thing is eat right, mostly whole food plant-based diet. Exercise, 90 minutes at least once a week or divided of intense exercise. I'm not meaning walking. Walking is not intense exercise. Resistance training is intense exercise. And some of you might say, if you're a vegan, and I am a vegan, if you're a vegan, where do you get your protein? And that's always, the millennials always tell me that. And this is your protein right here. So I think that there's ways to understand how to use old school medicine, sleep, exercise, nutrition, and I think that calming practice is very important. If you look on my website, I've got, the front page of my website says, let healing happen like it was supposed to. And this is for herbal411.com. I think it really resonates with me that no matter if you do old school or millennial medicine, you do have to get down to the basics. Now, some of you are too far gone, not really Felicia, but some of you are too far gone to get to basics, or too much pain to get to basics, but there's always a way. And if it can be tailor-made for you to get to the basics while you're taking care of the multiple diseases, I think that's important. So the bottom line is we have to embrace the science of millennial medicine, data-driven, multiple diseases, maybe mechanistic ideas on why it's presenting, why you have so many symptoms, how we can not necessarily relate and look for one disease process, but take a couple of different things and calm them down so that we can get you to do the old school thing. Sleep, eat right, exercise a little bit without hurting yourself, and have mindful practice. I think if you give the body what it wants, the soil that it needs to fix, the human body is awesome. It should be able to do that. The problem, again, is we have, and I'm sure it's doctor-driven from the late 90s and Millennium, and patient-driven because patients are also impatient. They want fast. They want to go back to work. They want to take care of their kids. It's multiple diseases all at the same time. So if you have one foot, whether you're a doctor, whether you find a doctor that does this, or whether you do it yourself, one foot in old school, always plugging away at that. If you have a sugar issue and you have diabetes and you have high blood pressure and cholesterol and can't sleep and you're obese, well, that's fine. We'll take care of that. But don't be doing the sugar all the time and don't be eating the pastries. If you're going to have guilt doing this, don't just say that you give up. Try to find another way around it. If your doctor doesn't give you options, beg, borrow, steal, get your relatives, get your best friends, be accountable to somebody else. But don't just do this and forget about old school. I think it's a combination of the two. And that's why I really think that it's not a division of the two things. It's the using the best of both worlds or formulating a plan for you. So if we have multiple diseases, that's okay. Take care of the prioritized top disease or symptom, work your way down, always having a top three, but then always going back to changing where your basic building blocks. Again, so that you can get your body to heal properly with what I just mentioned. Now, if you're too far gone and you're just suffering, I had a patient that is Hashimoto. She's also palpitations, and she had 4 ablations. She can't sleep, and she's got irritable bowel syndrome and brain fog. Now, where do you go with that? Because not only does she have all 5 things, 5 things in addition to a couple more, she's massively severe with each thing. So that's kind of like having old school heart disease, heart failure, liver failure, and kidney failure all at the same time. That's tough, but it's possible. I think it's still possible to dent the symptoms. It takes a lot of brainstorming. It might take a lot of other team members, other specialists, the right kind of specialists, not just the kind that want to cut, want to ablate, want to give heavy medicines. You have to think outside the box. But if you have your team of doctors to save, if you have your team of coaches to encourage, and you have somebody that will be an advocate for the patient to say, she's not just making this up, I think there is a true problem. And you usually have to be an advocate for yourself. But if you are wise and you keep on trusting, hopefully your team, but also empowering yourself always to get to a better level, no matter which medicines and how the severe the disease is, I think you will be able to get past your disease. If we can do that, and I think that's what integrative medicine is all about. I think that's what Andy Weil started with the Arizona Center for Integrative Medicine. And there's more of us coming out, but we all have different ways to apply this thing. If you can think like that, you can get doctors like that, I think we will be able to calm everything down and get everybody to still go backwards in time and take care of and get this multiple disease millennial presentation back to single disease problems. So it just takes a little bit of time. So hopefully this gives you a little bit of an idea about how I would rifle through the confusing environment of where we are, but always trying to keep on going back to the basics. So Felicia, don't be discouraged. I think there's always a way to use both schools of thought to get the best outcomes. Sometimes it'll be a big hiccup where one of them flares up, and that's okay. We'll flare that down, but we'll just get back to the same destination. You always have to have your destination. Another patient of mine came in today, so many problems, but there's different ways to attack the problem. But if you're in the midst of a forest, I take people on hikes all the time, so if you're in the midst of a forest and you're just telling this, if you're just getting the guidance of go to this tree, then go to the next tree, go to the next tree, well, it gets kind of tiring if you don't know where the end point is, and it's going to be like, why am I just going tree to tree? If you can do that, but also have somebody give you a map and say, you're almost there, it'll be 2 days, so keep on going, because we're heading that way. If you know the destination, you might have more investment in going tree to tree to tree to tree. So if you know where you want to be, which is going to be old school healthy, then it might be easier to navigate through here, go through medicine to disease process to medicine, and so eventually you end out on the other side. So that's the way I would use it. It's discouraging if you're in somebody's office that hasn't been integratively trained, but there's usually, if you go to the Arizona Center for Integrative Medicine and put in your zip code, there'll be a plethora of different docs who have all been trained like me, that Andy and Tiarona trained out of Arizona, or there's other fellowships that are coming out now, like in Wisconsin. So you should be able to find somebody with a little bit of savvy. If not, not that you're on your own, just use Western medicine, but empower yourself with complementary alternative providers, and this will hopefully give you good direction. So Felicia, good question. Those of you who are out there, if you are having difficulty with your presentation, please seek out somebody out of my fellowship, and it might give you a better, make things better for the time being, but always chip away at being healthy.